So it has been another day of the federal government on the defensive over its vaccine plan. The federal health minister did tweet today that Health Canada's review of the Pfizer vaccine should be completed soon. Let's bring in three members of Parliament to discuss the latest developments on all of this. Adam Van Koeverden is an Ontario Liberal MP and the Parliamentary Secretary to the Minister of Diversity. John Barlow is an Alberta Conservative MP and member of the Commons Health Committee. Don Davies is a British Columbia MP and the health critic for the NDP, also a member of that health committee. Good to see you all, gentlemen. Thanks for being here.
Nice to see you too.
Mr. Van Koeverden, let me start with you. Now that Great Britain has approved the Pfizer vaccine for use in that country, British residents will start getting it as early, as some people are saying, in a matter of days now. What additional pressure does that put, if any, on Canada to approve this vaccine?
I don't think it's a matter of pressure so much as it's a good news story because a quick approval time and turnaround from Great Britain means that we're likely to see the same thing here in Canada. Things like this take time. It's very important to make sure that this is a safe vaccine and an effective vaccine, and it's the right one for Canadians. And this is a really good news story that Pfizer's been approved in the UK because we've been working very closely with both Pfizer and the UK, and the NHS is, like Canada's healthcare system, a world-class healthcare provider. So it's a very, very positive step forward, and I'm very optimistic that our approvals will be done quickly as well.
Mr. Barlow, Health Canada issued a statement today as well saying it's doing its own review of the Pfizer vaccine, should be completed soon, is the way it's framed. Does your party support that position that Canada needs to do its own review, no matter how long it takes, but it sounds like it's coming quickly?
I think there can be some harmonization of regulations when it comes to the vaccine. I think every Canadian is on the edge of their seat, wondering when these vaccines are going to be available. And we've just heard too much of soon. Be patient. It'll be here. Too many mixed messages from the government, and Canadians are starting to
hang on. Sorry, are you saying Health Canada should just borrow that information, that review information from Great Britain and essentially rubber stamp it here?
No, I don't think they should rubber stamp it, but I think there is some harmonization, some of the regulations that have done that. A country like the United Kingdom, as Adam said, has a very strong healthcare system, and I think there are some things that we do not have to reinvent the wheel, so to speak, that there may be some ways to expedite the approval process here in Canada to ensure that those vaccines are available as soon as possible. But at the same time, obviously, you want to ensure the safety of Canadians.
So Don Davies, what's your view? Should anything change here in the approvals timeline in Canada because the British have now approved the vaccine for emergency use?
No, I think Canada has to do our own evaluation. That's the way we handle all drugs. I mean, whether something's approved in the States by the FDA or by Britain doesn't change the fact that Health Canada has its own responsibility to Canadians to do its own review. I do think there are some other points though that could be made. One is that in the U.S., Canadians may have seen a plane land last week with vaccine from Pfizer on U.S. soil, even though they have not received FDA approval. And Canadian law does allow that. We could be receiving Pfizer vaccine on Canadian soil pending Health Canada approval. And to me, it's smart policy to do that because the quicker we can get the logistics arranged so the vaccine is here and ready if and once it is approved, the faster we get vaccinations out for Canadians, which is what everybody's waiting for.
Although we know this particular vaccine needs to be stored at minus 70 degrees, and so to stockpile it in Canada, it doesn't appear that we're ready to do that now, are we?
Well, we have to do that sooner or later. I mean, the government talks about starting the Pfizer vaccinations in January. We have to have the freezer capacity. That's,
And it says it's got a bunch of the freezers now, and it's still waiting on more of them, but I'm not sure how much could be stockpiled. Yeah. Does that seem like an idea, Mr. Van Koeverden? Even before the approvals, stockpile it in whatever freezers we have now, try to get it in and be ready for when, on the assumption that Health Canada will follow the British lead and approve this vaccine.
Well, like my colleagues, Mr. Barlow and Mr. Davies, I am not a doctor or a health expert. I'm a politician. So I will leave the decision-making up to health experts and regulators, the people who have done such an extraordinary job for the last 9 months, but have always done a great job making sure that vaccines are available to Canadians. Because as we know, this is nothing new. There's a new vaccine for the flu every year. This is not the flu. I'm not drawing a comparison, but vaccines are available, and we do a good job in Canada with the provinces, vaccinating about 19 million Canadians every year with the flu vaccine. Again, not drawing a comparison between COVID-19 and the flu as other people have. I'm just stating that the vaccinating Canadians is something that, that Health Canada does extraordinarily well in partnership with our provinces, and I have the utmost confidence in our health officials to make those decisions.
Mr. Barlow, one thing we do know about Britain is they have a plan in place to distribute and administer this vaccine. The Prime Minister talked about it there today. They had a plan in place communicated to their citizens even before the vaccine was approved and will arrive. They know how it'll be distributed and who will get it. Do we have those answers in this country yet?
No, we don't. And with all due respect to my colleague, Mr. Van Koeverden, this isn't like any other vaccine. The Pfizer vaccine is very unique. It takes very specialized storage and transportation requirements. The United States also has Operation Warp Speed. They've announced they have a logistics strategy to get the vaccine out and distributed to its citizens. We have nothing like that, and we've asked multiple times to the government, how many fridges do we have? Who's building them? Where are they going to be located? How is the vaccine going to be distributed? Who's going to be distributed? Who's going to get the vaccine first? We have none of these answers, and I think that would go a long ways to addressing the anxiety and the mental health stress that Canadians are under right now.
Mr. Davies, in part, the answer from government officials that, look, vaccine delivery in Canada's it's complicated. A rollout's complicated because there's a range of vaccines with different requirements for storage and distribution. We need the participation of the provinces. It's a more centralized health system in Britain, for example. So it's a more complicated challenge in Canada than in Britain, for instance. Do you accept that as a reason for the time it's taking to put this detailed plan in place and get it out to Canadians?
Well, of course not. I mean, you've got countries as varied as the UK and the United States, who doesn't have a national healthcare system at all, and Australia. All three of those countries are much further ahead than we are. Now, Canadians only care about one thing. They want to start knowing when they can start looking forward to getting these vaccinations. And I think they're entitled to some specifics at this point. It's December 2nd. This government has been saying over and over again that they expect to start vaccinations in as early as January. Again, that's weeks away from now. I think it's time that the government gave specifics to Canadians. On a different point, I wanted to say that our leader Jagmeet Singh today came up with, I think, a really important policy initiative, and that is to
you want Canada to get back to manufacturing vaccines.
Yeah, and I think that's important because although it's not going to be done in time, to produce vaccines, say in the next 12 months, the COVID pandemic has revealed a serious deficiency in Canadian vaccine and medication production, and I think it's something that all parties should join together with Mr. Singh and get to work on creating a Crown Corp so that we can have, domestic self-sufficiency. Australia is producing 30 million doses of the AstraZeneca vaccine. So the US is, the UK is, Belgium is. So I think it's a big flaw that Canada is not in this position because we really are at the mercy of multinational pharmaceutical companies.
Mr. Van Koeverden, let me go back if I can here to the issue of a plan and what Canadians.
If I could, I'd like to address what my colleague said.
Okay, let me ask a question, and you can weave an answer into it, and we'll take it from there. One of the government's answers this week has been, we don't have a date yet, so it's hard to know exactly what plan or what vaccine we might be getting. But let's forget the date. Why would the plan wait for a date? Why don't we know what'll happen no matter what date the vaccine gets here? So the day after the vaccine gets here, it gets stored here. Then on day 3, it gets transported in trucks or airplanes to different provinces. Wouldn't we know that already, no matter what date it gets here? Like if you buy a car and want to take a trip across Canada, you set the trip. Doesn't matter what day the car arrives. Once the car arrives, you head out on the trip.
I think that buying a car is different than procuring.
Well, of course it is, and I'm not trying to minimize
from 7 different companies. But I would like to correct my colleagues just on a couple of points. One, the number of freezers are available to Mr. Barlow. If he's wondering how many freezers we've procured, we have those numbers. More than 40 freezers have already been received by PHAC.
You won't answer that question.
And she absolutely has, in fact, Mr. Barlow. It's just you're being quite selective with respect to which information you're willing to rely on.
We heard these numbers. Hang on, Mr. Van Koeverden. We heard these numbers at the news conference yesterday. They were revealed by Minister Anand. Here's how many freezers we have so far, and here's how many more. These numbers have been. We've
been forthcoming with the numbers with respect to the freezers, and the international media has been leaning on Canada's response and referring to Canada's response as the gold standard globally. So I refute
what we've talked about
notion.
What we're talking about here today is answers to questions about whatever time the vaccine gets here, What is the plan for the day after it drops in Canada? How are we getting it to Canadians? Who will get vaccinated? When do we get those answers?
Well, those answers are forthcoming, and they require us to first work through the Health Canada regulations and approve this vaccine. And these vaccines, there are a number of vaccines, and we don't know which ones. The rollout system will be a lot different if it has to be stored at room temperature at -80, right? But we were prepared for all of these scenarios, all of the outcomes. We're more than prepared, and international media has been very, very forthcoming with that notion. Both from Nature and other very well-regarded publications have all been saying that Canada's reaction and Canada's vaccine procurement has been gold standard.
Time is tight for tonight. I'm going to have to cut it off there, but thank you all for your participation. We'll continue to look for answers, and we'll continue to see the vaccine story unroll in this country. But thank you all for your time tonight. Appreciate it.
Thank you, Peter.
Thank you, Peter.
Take care.